and welcome to Canceling COVID. Thanks for watching. I'm Tanya Rivens, a place for real talk. And of course, we come up with real solutions. It is a safe place, and we're looking to stay safe in the middle of the COVID-19 pandemic. I appreciate you all tuning in. We're so excited about our guest today. Want to say thank you to our sponsors, Mecklenburg County Public Health. You can always reach out to them if you have any questions for more information. Of course, it's mecnc.gov, mecnc.gov, or you can always call 980-314-9400, 980-314-9400. Now, the Delta variant continues to surge, and the CDC is warning you to get your flu shot. Make sure you get it earlier this year. We're talking about the flu shot. Ideally, you want to get that before October. There's concerns of the flu and COVID-19 kind of creating a super infection, and that's a legitimate concern. We'll get some experts on to talk about that. But that means our question of the day is back. We had it on Friday. So the question of the day, as you hop on, I see you all joining us. Has the increase in COVID-19 cases made you more concerned about flu season? I'd love to hear your feedback and your comments. Are you more concerned about the flu season? There's so many things we can discuss along those lines because if you got the flu shot before, are you getting it now, or just one shot's enough, or the heck with all this stuff? Please share your comments in our chat. Of course, our other sponsor is none other than Groundwater Solutions, and Dr. Tricia Black will be joining us shortly. We're grateful again for all of the support. These are reliable resources, folks, that you can reach out to. And I just can't say enough how grateful I am. We kicked this off in January. We're still at it in August, which is a good thing, but not so much either, because we thought we would be beyond this and kind of back to our new normal. As you can see on the screen, scrolling across, we reported 5,300 new COVID cases on Tuesday. That's up 750 from Monday. And I think I saw where we were holding steady for a little while, and now, we're back up again. But I am starting to hear from people that were hesitant, that were waiting. They are going and getting their vaccination. So I'll share that with you in just a moment. But starting today, what's being called a pandemic within a pandemic. And that, of course, folks, is domestic abuse. Domestic violence is real. And something that really is near and dear to me. I always say this to every female in a relationship, and this male or female, who amongst us haven't been close to that situation or drawn into that situation, but you've got to be empowered, encouraged to know that there are options for you to get out of it. And of course, us living in tight quarters, all the stress and so much going on, domestic violence, domestic abuse is real, folks. So our first guest, she's an attorney. Her name is Alana Brown. She's with the Safe Sister Circle. I've been waiting to get her on. So if we could bring up attorney Alana Brown for our producer, certainly I appreciate her joining us. So good afternoon, and thank you so much.
Thank you for having me. Good afternoon to you too.
Absolutely. So we're starting today with what's being called a pandemic within a pandemic. And the stress of COVID-19, is putting quite a growing number of women. They are at risk of violence in their home. And I don't want to just say women, because it's men and women. In fact, North Carolina had 2,000 additional reports of domestic violence in 2020 compared to 2019. And that's a huge increase. Nationally, the rates of abuse increased to about 50% higher for women marginalized by race, ethnicity, sexual orientation, and more. So it was increased by 50%. But then for those groups, women marginalized by race, ethnicity, sexual orientation, and more, it was even higher. Those numbers are staggering, Ms. Brown. So first of all, thank you for the work that you're doing in the community. But let's kind of talk about, as the executive director of Safe Sister Circle, you guys provide free, culturally specific, holistic, and trauma-based services to Black women survivors in the Washington, D.C. area, which is a mouthful of a whole lot of what you guys do. So let's start by talking about, what does all that mean?
It basically means that we are geared towards Black women. We center Black women and girls in the Washington, D.C. area, specifically Ward 7 and 8 of the Washington, D.C. area, which are predominantly Black, disadvantaged areas within the D.C. area. We center their problems and their pain and their voices, and when we got to provide them services. So culture specific is mainly that we have Black attorneys. I'm a Black woman. I started the organization. We know we've all dealt with racial trauma together. We've dealt with trauma with being a woman, and we bring that information and that trauma experience to helping the client. We've also been trauma informed training 40 hours every year to make sure that we can deal with people who face trauma on a daily basis, like our survivors. We also do sexual abuse along with domestic violence. And holistic is we also try to give people like counseling, housing, career advice, different other services besides legal. Our legal is our bread and butter, but we do have people for connections in the community, the Ward 7 and 8 community, that give people other resources to help them get back on their feet after they've, survived abuse.
Well, thank you so much. I mean, that's a lot and obviously much needed. So, what fuels your passion to work with Black women? You said you started there as well.
Yes, I founded it. So I founded it because, well, one, I'm a Black woman.
Uh-huh.
I grew up in DC. I'm from DC area, and I saw a lot of abuse growing up as a woman of color. And I know that domestic violence affects Black women more than any other ethnic group and race in
Mhm.
America. Unfortunately, we have the highest rate of domestic violence. And so I knew it affected people in more particular areas than other areas of DC.
Right.
And I knew there needed to be something about it. And I saw there was a cultural disconnect because a lot of the providers of domestic violence services are, to be frank, white women.
Yeah.
And people that are getting served were Black women. And there was a very cultural disconnect of services between the people providing the services and the people receiving services. And I thought, that's a problem. We need to have us helping us. Not to say there's anything wrong with us not helping us, but I think there need to be organizations that provide, or people that look like us providing each other with services that are centering us. People are saying, oh, you don't need an organization for Black women. You don't need an organization for Black people. That's not necessary. But there are organizations in DC for like Latinas, for Asian Pacific Americans, for immigrants. So why not Black women? Why don't we not deserve to have our voices heard or have an organization that's geared towards us providing these type of services? And so that's where my passion kind of lay. I started as a prosecutor in New York, doing special victim crimes. That's kind of
Wow.
how I got into the background of like women's rights and women's gender-based violence, but kind of take a non-carceral approach to things now. But that's where I did start. That's how I got kind of involved in this line of work.
And we can hear your passion really coming through. And of course, African American women have had a history of violence in this country. And of course, a lot of it stems back to slavery. A lot of people don't want to talk about that, but generationally, those curses have just been passed along over and over and over. Are there anything else or any other factors that put us, at risk at such a higher level?
I mean, it's the factor of, I think, one factor I would say is that women who are in higher areas of violence experience, I mean, I think it goes without saying, if you live in a violent area, you're going to experience more violence. But unfortunately, a lot of high rates of violence areas are where a lot of minority women live, marginalized women live. So if you're in a violent neighborhood, a violent community, it gets trickled down to the home when there's more violent abuse going on within the home. So
Yeah.
that is a factor. Like if you live in high crime, impoverished neighborhoods, there's a higher chance of there being abuse in your home.
And
Another aspect would be that Black women are often not believed and they're not victimhood. People don't listen. There's the phrase right now to listen to Black women, but Black women are often not listened to. And so a
yeah.
lot of times people don't believe Black women, they're strong, they're powerful, they can't be hurt, no one can hurt them. They can't be victims, they're not gentle, they're not, survivors. And it's just like this idea that Black women can't be domestic violence survivors or sexual assault survivors, or they can't be raped in terms of sexual violence. Black women are unrapeable. Like these ideas of Black women not being allowed to be victims and society hurts Black women and it hurts their credibility. We're going into court for a lot of cases that we have. We see like implicit bias or anti-bias against our survivors based on what people think they know about them and know about their background or who they are as people. So
Wow.
that's other factors I would say to take into account of survivors. It's like double. You're already dealing as a survivor. You have to deal with life as a Black woman. You have to deal with life as a Black woman survivor, and have
Yeah.
to don't listen to what you have to say or trust you.
That's a whole lot to kind of just take in, which is really unfortunate because it's like you're traumatized over and over and over in so many different ways. And, it's good and bad that we are strong women and we just take it and deal with it. But it's not so good when, we all need some assistance at some point. We all have a breaking point. And I know how tough it is, especially when you're loving someone and domestic violence is an issue and people really don't want to be forced to have to take, steps, but you certainly should never be in a relationship that's not healthy for you. So growing evidence shows the pandemic has made intimate partner violence more common and often more severe. And one of the reasons I'm sure is because of the close quarters, the staying at home. What are some of the other factors?
I think quarantine is definitely the main problem. People can't get out to report it. People can't escape their situations.
Yeah.
I think it's just, I think part of it is people mental health issues that has caused trauma for everyone in this country being
Right.
part of the pandemic, and it caused things to be more extreme. So I think the violence has gotten more extreme. It's caused more stressors on both the abused and the people causing the abuse have gotten more stressed out. They're facing trauma themselves being part of a pandemic, losing their jobs, seeing violence against Black bodies in the country by the state and by other people. These are Black men who see this and then are going and may hurt Black women or vice versa. So it's like,
Right.
there's all this kind of pressure and stress and anti-Blackness and poverty and joblessness tied into the pandemic and the racial reckoning that's going on right now. And then you add that to a home where people can't separate from each other, and you have
Yeah.
kids in there, and it just makes everything to kind of explode.
Yeah, as you can imagine, and of course, COVID has really impacted, I'm sure, your work as well. When you say explode, is that what you all have experienced there at a Safe Sister Circle concerning your numbers?
Yes, if they've exploded, they kind of went down a little bit. There was a period of quietness, and we and
Mhm.
people were like, what's going on here? We feel like these
Yeah.
rates should increase. What it was is that people weren't free. People weren't able to escape to apply for domestic civil protection orders, which are kind of
Um,
like restraining orders in DC, or
okay.
or just go to custody cases because they were literally trapped in the home during quarantine. So when
Yeah.
things started lifting a little bit, in DC, I think probably had higher quarantine things in North Carolina. We like shut down.
Yeah, we did too for 3 months.
Okay, so yeah, so so when they're in that shutdown period.
Yeah, we were the other Carolina that actually had some kind of logic and was intentional about, look, we need to survive this thing. So yeah.
Okay, so then that during that shutdown period, we had very low rates. As soon as that lifted, our rates like tripled of people
Like a
coming to
flood.
services.
Yeah. Wow. So how many, like your staffing, did you have to increase staffing to
So I
handle it?
did have to increase staff. So it was me. I'm a practice attorney, so I practice have a caseload, which is unusual,
Okay.
but that's how I roll. And
Yeah.
then we had another attorney, and then we've hired two new attorneys on staff.
Wow. Well, we appreciate that. Now, kind of let us help you out, though. And for those that are watching and listening, if you spot a sister around that's being abused, what are some of the warning signs that people should look for?
I think the warning signs are a little low key. I think it starts out of isolation. I would say isolation is a big warning sign. It tries
Mhm.
to isolate you from your family, isolate you from your friends, takes you like physically isolates you or mentally isolates you or turns you against your friends. I think that's a big one. We go to like high schools a lot and tell people like these are things that young people should look for. That's a big
Yeah.
one, isolating and telling them like you love your friends more than you love me, and gaslighting and things like that. A
Right.
lot of the physical abuse, you see signs of physical abuse on them, and they're not getting it from basic things like you're
Right.
not getting a black eye or getting like marks around your neck from strangling yourself. You can't strangle yourself. There's all these signs, but I would tell them though to talk to the person timidly. I would not tell them right away to like tell the person to escape because people don't respond well to that.
Yeah.
I would approach them with kindness and open heart and like open ears and just kind of like listen to what they have to say and really suggest to them, like, this, like, think about the situation that you're in. I wouldn't tell them right away, like, oh, girl, you need to get out of that situation now. That doesn't
Right.
really happen in most cases. I
Yeah.
tell people that, and I'm a lawyer, and I was like, get out this. Like, we don't even do that anymore because it doesn't work. Um, but I would say like isolation, physical injury, moving people around, stealing their money, controlling their money, stalking them,
Mhm. Wow.
having like stalking devices on their phones and stalking devices in the car, like wanting to know where they are at all times.
Yeah.
These are just like things like power based dynamics where you want to have power over another person, where there's no power, man over woman or woman over men, having power over your partner
Yeah.
are signs that there's could be abuse there or abuse is coming your way.
Just a real quick note, Erica Simonton Beatty has hopped on. Good afternoon. Thank you so much. We've got the question in the chat if you're concerned about flu shots. So we're still talking COVID talk, canceling COVID. I've got attorney Alana Brown. We're talking about domestic abuse, domestic violence. And as you were talking about, be careful. You can't say just get out because, that friend, and there's been plenty of situations where they will get angry with you and then you cut off all communication. So at least try to be diplomatic when you're advising them and talking with them in a very caring way, which isn't easy because you and I kind of talked about before, not even just the physical abuse, but there's a thing called verbal abuse as well. If someone's constantly, you can't do anything right, you're not smart enough, all these other things, it's time for you to say, go ahead on, you probably can find somebody else. And I'm saying you speaking that to your partner because no one deserves to be torn down, beat up, whether it's physical or verbally. So I really appreciate you sharing. I would love for you to share with us now, how can we support Safe Sister Circle and anything else that you would like to leave us with before you sign off today?
The first one I would ask you to look for organizations in your community that support survivors and support them, either volunteering or financially contributing to them. I know all nonprofits, we always take donations. We're always open to that. But if you mind to donate to us personally, like specifically, that would be amazing. Also, you can go to our website. It's Safe Sisters with an S, safesisterscircle.org. And when you go to our website, you can join the newsletter and get updates about our organization. You can also be taken to a donation page where you can donate money to our organization. So you can do either of those. And if you come to DC and you have any questions, feel free to contact me. You can contact the info information goes right to me. If you have any other questions today, feel free to reach out to us and I'll be glad to answer them. So just, you can stay in touch with us and we'll let you know what's going on in the DC area.
Good job. Great stuff too, Attorney Brown. Thank you so much for taking the time to talk with us. She's a part of the Safe Sisters Circle in the DC area, and we appreciate your insight and all that you've shared. So thanks again for taking the time to speak with us.
Thank you for having me. Have a good rest of the day.
Absolutely. You do the same. Folks, we're going to continue to touch on issues that are so impactful. As we were talking about domestic violence, if you think about it, with the children even heading back to school right now, that creates additional pressure. Things are going on at school that need to be addressed. It doesn't stop. That's why we're here to pass along information and work with you. Now, unvaccinated people, as we shift gears, are 15 times more likely to die from COVID-19. Let's talk about this again. Unvaccinated, because you won't get the vaccine, you're 15 times more likely to die from COVID-19. Now, patients are dying so quickly that hospitals are considering setting up mobile morgues. Mobile morgues is one of the things that they are considering. I think we have some information that's going to reflect what I'm sharing with you. UNC Health Southeastern in Lumberton has already done that. And it's so sad for me to hear that because I know the Lumberton area is always one of the areas that they struggle as far as the poverty line. And here they are dealing with something along these lines. And so what we're going to do today, someone that knows about these areas, that's always out and about. Again, they sponsored the show, Groundwater Solutions. I'm going to pull in Dr. Tracia Black because that's what she does, grassroots, and she's out and about working. If you know the Lumberton area at all, you know that it's the Lumbee country, and these are wonderful people. It's just unfortunate that we're not able to get them the resources. I would probably say underserved before, and now look what's happening, and we hear that with a lot of places. I see Lynn Galuli has hopped on. Thank you, Lynn. She says an important subject. This pandemic has probably made domestic violence even worse, and she's absolutely right. We already shared those numbers. It peaked at an incredible rate, not just for regular folk, but it peaked for women of color or marginalized populations. But Dr. Black, I hate to start or don't want to use the word hate, but to come in on such a somber note, but we're seeing more breakthrough cases for people that are vaccinated. Right. People are contracting COVID. The most severe cases are still though with the unvaccinated. And what are you and Groundwater Solutions doing to reach these people?
Tanya, I think what we're doing is really trying to have dialogues with the entire community. I believe that it is going to take trust before we're going to get this pandemic at a manageable place. We've talked about before that those folks who are not taking the vaccine, they are at the point of vaccine refusal. Wow. So we're not hesitant anymore. Have made the conscious decision based on the literature, the information that they have, not to take the vaccine. And so I think we've got to still stay safe, and we've got to talk to those that are unvaccinated about how to stay safe, and those that are vaccinated how to stay safe. and I'm wishing and praying that we are not so polarized, that there's not such division that keeps us from having open, honest, and transparent dialogue. And I think that is what keeps people in the emergency rooms and in the hospitals, because we're not really talking about real issues.
Yeah, I was with some people yesterday in a meeting, and neither one had a mask on, and I had mine on, and I asked them, and neither one was vaccinated either. And I started to get up and say, okay, but instead I had a conversation with them, and I asked them both, and I told them, I'm not gonna. There's no division here. Your decision, your decision, but I just want to know why. And one was like, I'm going to eventually get it. I know I am. I've just been putting it off. I was hesitant, but now, and I answered some questions. And the other one was a young lady, and she talked about the healthy alternative, and I saluted her. If you can do it, then that's great. There's nothing documented that proves it, but if that's your route. And then I concluded by saying, thanks for answering my question. Thanks for the conversation. And I will not fall out with anyone along those lines. Now, we're talking
about. I commend you for taking that approach.
Yeah.
Because what we normally see is there's this attack. We're so ready to attack those that are unvaccinated. We're so ready to preach to and talk at, as opposed to really listening and having that dialogue and conversation. So until we can get to that place that we're not attacking either side, that the vaccinated are not attacking the unvaccinated and vice versa, we're not going to move ahead as a community and as a nation. So I need to have more of that, and we need to have more of those kind of conversations on a larger scale. That should be the method and stream that we're utilizing, as opposed to more media and more pro-vaccination campaigns, because they're not working.
Right, and trying to shame people. But you know what? I've learned this from you and everybody that I've worked with, working with Atrium Health and seeing how the doctor, just take the time and listen and acknowledge it, instead of saying, well, you're the reason why, whatever my thoughts may be. So I just appreciate you acknowledging that. And I think you're right. I mean, that's what we've got to do. And maybe, just maybe, you'll plant a seed where that person eventually will decide. Now, I'm hearing more people now, especially close in my life, that were downright, I'm not going to do it. They're getting it. And for whatever reason, some of it's because their children are getting it, and they're saying, look, I'm not doing this, forcing my child to do it. If I'm not going to do it, that's the wrong example to set. And I know some real procrastinators that were just, I'm flat out no, but they've changed their mind now. And my girlfriend, I'm not going to put her on blast, but she told me she was even crying, why she was getting it, because that's how disturbed and uncomfortable she was. But it's part of her job now, and she loves her job. And so, we're making progress. And talk about taking these vaccines. Now the CDC is warning people to get the flu shot. I'm just going to be honest with you. People are probably like, I ain't taking that. If I got to take one, how am I going to take the other? And the flu shot, what's that? Who's thinking about the flu right now? Which, of course,
that when we're in the middle of the COVID-19 pandemic.
Yeah.
I believe healthcare is healthcare.
Yeah.
And we've got to stay healthy all the way around.
Right. So there's a concern that there may be, some type of super infection with the Delta variant here. Are you more concerned, or what's your thoughts about, this narrative to get out and get your flu shot?
Well, I think, again, healthcare is healthcare. You need decisions that are necessary to keep yourself, your house, community safe. And I think influenza is just one of those things we have to guard against as well. I think those folks who normally take the influenza vaccine should take the flu vaccine. Go ahead and take it. Yeah. But I'll be honest, I'm less concerned about the flu because we saw the numbers go down last year. I think if we mask, if we do all the things that we know will keep us alive, I think the flu will be event as it was in 2020 or the early part of 2021. So the problem is we don't do those things. Right. And so if you're not going to do those things, you better be out there getting every vaccine possible.
Yeah, especially if you want to live, and live a comfortable life. Yeah. So Governor Cooper now is talking about expanding the antibody treatment. And that's just to help, provide relief in the hospitals who've been slammed with patients. And, guys, I have to just make this point again. We have talked, and one of the things Dr. Black and my producer do, all this information we put out for you, and the Delta variant, shouldn't have been a surprise. We knew it was coming. We keep on giving you this information. You know, the hospitals are slammed right now with patients. You've often talked about early detection. How does that help the antibody treatment be more effective? Or does
It
it?
absolutely makes it, it does. It makes it more effective. The antibody treatment is for early folks who are positive for COVID-19 and they're in the early stages, then we know it to be effective. If you have been had a possible exposure, even before you get a COVID-19 test that is positive, you can take the antibody treatment. You can also take the antibody treatment if you have high risk conditions, become part of your normal routine to stay healthy and free of COVID-19. So I think it's a very viable treatment, but again, you need to, early detection is key. When COVID persists, your body and your organs are deprived of oxygen, and the mucus and inflammation build up and all of that. So the earlier we catch it, you're more likely to survive and have minimal after effects.
Wow, that's some good information. And some other good information.
And really, when I say early, I'm talking 24 to 48 hours. I'm not talking, you know, sometimes when we get past that first 4 to 5 days, you're in the late stages of COVID. The damage is already occurring. So really, which is why I say regular testing at least once a week, because you want to be catching this in the first couple of days.
Well, my cool friend Lynn says she's got some friends that are taking, I guess that's called ivermectin, and she said it worries her because she doesn't want to tell them what to do. But she mentioned that monoclonal antibodies, and I'm not sure, you probably know how to pronounce it better than me, to one of them with COVID. And she's saying, you know, what do you say to patients taking that? That's probably a question for someone that administers it. But Dr. Black, are you willing to weigh in on that one?
Well, I say that with your medical provider. With all medications, there are pros and there are cons.
Right.
And so I'm not sure what the person is taking the medicine for, so it's really hard for me to comment. But I do know, under the care of a reliable and trustworthy physician, there are ways that you can protect yourself medicinally with COVID-19. There are natural supplements. There are different strategies. Again, just have a plan in place and do something. Do something to be preventative and do something when you have potential exposure. Test regularly. These are the things that are going to keep us alive. And I personally feel led to, you know, keep us alive. Want to keep us alive. So if that person is taking ivermectin for a viable medical reason, I don't think long-term situation, a long-term solution, but I think solution.
Wow. So this talking about solutions, the last time we talked to you, boy, you got me really excited. You were talking about that collaboration, getting community workers in the state to remind us how to, you know, tell us more about that. How's it working out? And you got any updates for us?
Okay, so we are working with Southeastern Healthcare in Raleigh, North Carolina. We're working with GROW, which stands for Green Rural Redevelopment Organization, who are farmers and believe food is medicine, and Genesis Project and Groundwater Solutions. So we're covering about 25% of North Carolina. We will be providing community health workers. We are still hiring. We have interviews starting tomorrow. Community health workers, if you are knowledgeable about the you live, you know the resources, you're a people person who, you know, you're comfortable going out and talking to groups about their healthcare, about things such as the vaccine, having those kind of conversations that Tanya talked about having with those young folks earlier. If you're that person and you can do that, please contact us, because we need to put health care workers, stand them up in 25% of the state who will get out there and help us be healthy and live through this pandemic. You can call 704-596-505, and we'd be happy to talk to you about whether you're a good fit for our organizations.
Wow. Thank you so much for that, Dr. Black. And along those lines too, where are you guys out today? You're always out and about in the community, always giving back, always supporting. So where is Groundwater Solutions working today as we put up your website and your phone number?
Okay, we are at University Adult Care in the University area in Charlotte. We're also at Kitty Land Daycare here in Charlotte. And we are always Monday through Friday at our office located at 5104 Reagan Drive off of I-85 in Sugar Creek Road. You can reach us again at 704-596-0505, or you can register to be tested or have the vaccine at www.groundwater-solutions.org.
Oh, Dr. Tricia Black, it's always great to talk to you. And thank you so much. I'm
You
getting
too.
excited now. We're counting down the Praise in the Park. Groundwater Solutions, one of the sponsors. We got the radio, all the promotion going now. And so looking forward to seeing you, of course, every week, but it's certainly on the 18th.
Absolutely.
So we can just go out, celebrate one another. Thank you again to Dr. Black. Now, in other news, as we start to wrap things up, my producer ain't playing. She's like, we're going to stay on point, Tanya. In other news, North Carolina students have barely returned to class, and COVID has already put a dent in the school year. And I was just hoping that we wouldn't get to this point, but we're gonna work through it. Right now, CMS is reporting cases in nearly 100 schools. Districts in North Carolina, they now have the option to switch to remote learning if need be. And I thought that conversation when I had it with someone with the school said that the state, our lawmakers didn't allow that. That's a whole nother conversation. But also making news, state employees in North Carolina may soon have to show negative COVID-19 tests to work. I have my thoughts on that as well. As a small business owner, you know, you got to protect your investments. So we're talking about the state, which really needs to continue to operate so that we can continue at this thing called life. Well, my time is up, my friends. I appreciate you oh so much. Thank you, Lynn and Erica Simonton Beatty. I see more of you on. I really wish you would share your thoughts. But one of the things you can do to really help us out is share this segment, continue to share it. So that's an opportunity for people that weren't able to see it or don't know. You have to admit we've got some great information. So here's a way that you can share it and the conversation can continue. And my producer just made a note that our Governor Cooper did sign the bill. And this is where state employees will have to show negative COVID-19 tests to work. That's when she said the bill has been signed. That's what I was recently referring to. So I'll be back here on Friday. Folks, make sure you hop on at 1 o'clock. Share that Canceling COVID continues to provide great information. Thank you to attorney Alana Brown, Safe Sister Circle, talking about domestic violence, domestic abuse, and Dr. Tricia Black, always on point, talking about relevant information in our community. As always, life's challenges make you better, not bitter. I'm Tanya Rivens. Thanks for tuning in. Have a great day. Stay safe, and we'll see you on Friday. Together, we will cancel COVID.